Good morning, everyone. Class today is on basic life support CPR. So, what is CPR? CPR is cardiopulmonary resuscitation. Is an emergency life-saving procedure performed when heart stops breathing. Immediately, CPR can double or triple the chances of survival after a cardiac arrest. So, what are the components? You have to activate emergency response. You have to do a high quality CPR. You have to use a defibrillator if available, and you have to call for advanced resuscitation, then post cardiac care or cardiac arrest or an emergency room, and then recovery. The six links in an adult out of the hospital chain survival are recognition of cardiac arrest and activation of emergency response system, call 911, early CPR with an emphasis on chest compressions and rapid defibrillation, advanced resuscitation by emergency medical service, post-cardiac arrest care, recovery including additional treatments, observation, rehabilitation, physiological support. How CPR is done? There are two common ways of versions of CPR. For a health professional, those are trained conventional CPR using chest compressions and mouth breathing to 30:2 compressions to breath. In an adult victim, cardiac arrest, it is response is reasonable for a situation. Perform chest compressions at the rate of 100 to 120 per minute at the depth of at least 2 inches for an average adult while avoiding excessive chest compressions. For a general public or bystander who witnesses adults suddenly collapses, compressions of CPR or hand-only compressions without mouth-to-mouth breath. It is recommended for use of people who see teens or adults sudden collapse and opt out for hospital settings. High quality CPR. High quality CPR should be performed by anyone, including a bystander. There are five critical components. Minimal interruptions in chest compressions, provide compressions of adequate rate and depth, avoid leaning on victims between compressions, ensure proper hand placement, avoid excessive ventilation. So, what's the difference between a cardiac arrest and a heart attack? Cardiac arrest occurs when the heart malfunctions or stop abruptly, and which is triggered by an electrical malfunction, or it may be caused by arrhythmias. But a heart attack occurs when there is a block in the artery and oxygen supply to the muscles are affected, and thus cardiac arrest can happen. So what happens? Seconds later, the patient is going to collapse, unresponsive, and is only gasping for breath. What happens in a heart attack? Symptoms of heart attack include discomfort, severe chest pains, sweats, nausea, vomiting, and unlike cardiac arrest, the heart usually doesn't stop beating, usually on a heart attack. So what to do on both cases? Both cases you need to do start with the CPR and a high call, and you might have to use an AED or automatic external defibrillator, and whatever has to be done, you have to take the patient to a good emergency resuscitation team, and you need to save the patient. So summary, an adult with a CPR of depth of 2 inches, and in children, one-third the depth of the body, head tilt and chin lift. Head tilt is and chin lift is done for proper ventilation, and the cycle of 30 is to 30 compressions and 2 breaths with an AED of five cycles and then repeat. So that ends the class on CPR. Thank you.